If you're suffering from vertigo, maybe you experience dizziness or lightheadedness, brain fog, you have difficulty with your balance, this video is for you. My name is Dr. K. I'm an upper cervical chiropractor, and by now a lot of you have probably heard that Atlas alignment, getting your head on straight, is very effective at helping people with vertigo. Spend a couple minutes with me here and let me show you a recent patient that came to the office. This is a middle-aged man that suffers severe vertigo episodes. Over the last couple of years, these episodes have becoming more severe and they've been happening more often, which is an indication that the underlying cause has been progressively getting worse over time. So we started off, we took specific x-rays of his neck, and what we can see right off the bat from this side view is that his posture is very bad. What we want to see is the neck curve following more closely to that blue line. What we see in this case is that he's got forward posture that is going forward to the midline, putting extra stress on these lower neck joints. What that also does is that puts extra stress on the atlas joint. The atlas joint is the uppermost joint in the neck. It's the bone that your head actually connects onto. And when you have forward posture, you're not going to end up looking at the floor. Your neck is actually going to tighten at the top so that it keeps your eyes looking forward. And what this does is it puts extra stress on your atlas bone, making it more prone to misalignment. When the atlas bone misaligns, not only is the blood flow that goes in and out of the head can be altered, but it also puts undue stress on the brainstem area. The brainstem sits just above that connection, and there's areas within the brainstem called the vestibular nuclei that control your neurological perception of balance. So disruption to this area can directly cause feelings of vertigo or nausea or issues with their balance. That's what we're looking at in this case here. This is that same patient. This is a view from behind. And what we can see is that the horizontal line of the atlas is tilted up on this right side, and it's causing him to have a little bit of left head tilt. And in response to that, his lower spine is tilting in the opposite direction. It's shifted off to the left here. And that imbalance of the 15-pound head, how it sits in gravity on the atlas bone, is what creates these postural tensions that we see in patients with atlas misalignment. The head goes out of alignment and the entire spine compensates as a result due to the neurological receptors in this area. So what we're seeing in this case, if you look in the upper left-hand corner, over 13 degrees of misalignment of the atlas bone, how the head connects onto the rest of the neck. Again, the atlas bone is actually physically tied to the brainstem and to the spinal cord in that area via the dentate ligaments. So as that area gets twisted out of alignment, there's going to be physical torsion and tension placed on the spinal cord in that area. And if you disrupt those nuclei, the areas of the brainstem that control and regulate balance, you're going to have issues with vertigo, as we see in this case. So for people that are unfamiliar with Atlas chiropractic, upper cervical chiropractors analyze the alignment of the atlas joint. And for patients that come in with neck pain, headaches, vertigo, dizziness, lightheadedness, brain fog, if we detect issues with the alignment of the atlas joint, so often when we correct this alignment, we take pressure off of the brainstem, we put the head back vertical in gravity and take tension off of the area, we see patients respond very favorably. So if you're having symptoms that have been going on for weeks or months or even years, and nothing seems to clear it up, no amount of stretching or medications or changes in your diet have improved the symptoms, then be sure to get the atlas alignment checked, because if we normalize and we put your head back on straight, then good things tend to happen.